Hello friends. Many people worry about cancer. It is one of the most feared diseases around the world. Some people never drank alcohol. Some people never smoked. Yet they still get cancer. This makes many ask how this is possible. On the other hand, there are many people who drank a lot and smoked for many years, but never got cancer. This can be confusing. The truth is that cancer is very complicated. Drinking alcohol is known to increase the risk of getting some types of cancer. There are at least 7 types of cancer linked to drinking. Liver cancer and breast cancer are 2 examples. Smoking is even more dangerous. It increases the risk of 16 different types of cancer. Lung cancer, mouth cancer, and throat cancer are just a few. However, these are not the only types. There are more than 200 types of cancer. Each type starts in a different part of the body. So alcohol and smoking are 2 major causes of cancer, but many other factors can also lead to cancer. What are the other things that we can change in our lives to lower the risk of getting cancer? Understanding how cancer works is important. To understand cancer, we first need to know about cells. Cells are the building blocks of our body. Every day, around 330 billion cells in our body die and are replaced. This is a huge number. Friends, our bodies are constantly changing. When we talk about cancer, we also talk about stem cells. Stem cells are very important. These are special cells that can become many different types of cells. For example, stem cells can become blood cells, skin cells, and muscle cells. They also help repair damaged tissues. Stem cells are very important when we treat blood cancers and blood disorders. At the start of pregnancy, when a fertilized egg becomes a blastocyst, the stem cells in it are called embryonic stem cells. These cells can turn into any type of cell that the body needs. However, as we grow, our bodies do not have the same type of stem cells. In adults, stem cells are called somatic stem cells. These can only turn into the types of cells needed for the specific tissues or organs they are in. For example, the stem cells in our brain can only become brain cells. Stem cells in our skin can only become skin cells. There are about 400 types of cells in our body. This includes red blood cells, white blood cells, nerve cells, fat cells, and skin cells. Research shows that our bodies have trillions of cells. A young child has around 17 trillion cells. An average adult female has about 28 trillion cells. An average adult male has around 36 trillion cells. This means that there are many cells in our bodies. Every day, billions of cells die, and billions of new cells are created. Around 330 billion cells are replaced each day. This is about 1% of the total number of cells in our body. There is a saying that goes like this: "You are not the same person you were this morning." This means we are always changing, just like a river. The process of changing and regenerating cells is done by stem cells. Different tissues regenerate at different rates. For example, our liver is unique. The liver can grow back even if a large part of it is removed. If someone loses a big part of their liver, it can grow again. But this does not mean that the liver cannot get damaged. Drinking alcohol can seriously harm the liver. Some people think that beer is not an alcoholic drink. Others believe that wine is good for health. But the truth is that alcohol can damage the liver and raise the risk of liver cancer. If you eat junk food and gain weight, you can also damage your liver. Now let's go back to the topic of stem cells. It is important to understand how different types of cells in our body regenerate at different rates. For example, a study showed that each year 10% of fat cells in our body are replaced. This means it takes about 10 years to replace all the fat cells in our body. What about our brain cells? Can they regenerate? This has been debated for a long time. Most scientists believe that we are born with most of the neurons in our brain. This is about 100 billion neurons. But some recent studies suggest that limited regeneration can happen in 2 parts of the brain. The first is the hippocampus, which is involved in memory and emotions. The second is the olfactory bulb, which helps us smell. The other neurons in our brain do not regenerate. They stay the same throughout our life. Apart from the brain, our heart, spinal cord, and joints also have very limited ability to regenerate. This is why diseases or injuries in these areas can be very serious. However, many other body cells can regenerate quickly. For example, our skin cells shed about 500 million cells every day. This means our skin completely regenerates every 4 weeks. The lining in our intestines regenerates in just 5 to 7 days. Our body can produce 2 to 3 million red blood cells every second. Red blood cells have an average lifespan of only 120 days. Stem cells are amazing. They help our body constantly create new cells. This is why if you get a scratch, it heals. If you donate blood, your body can replace it in just 24 hours. The red blood cells you give can be replaced in 4 to 6 weeks. But what happens if a cell's genes get damaged? Genes are like programs with instructions for the cell. If a gene changes or has an error, it is called a mutation. This can disturb cell growth. Our bodies have mechanisms that fight gene damage. For example, there is a gene called the p53 tumor suppressor gene. This gene acts like a security guard. The protein from this gene can repair damaged genes. There is also a gene that tells older damaged cells to die. This process is known as programmed cell death or apoptosis. This means that damaged cells are told their work is done. Our body has security guard genes, filter genes, and mechanical genes. These genes can stop the growth of damaged cells, repair them, or remove them from the body. But what happens if these genes get damaged? If the security guard, filter, or mechanic gets damaged, who will do their jobs? Unfortunately, no one can take over. This situation leads to cancer. If a cell's gene gets damaged due to mutation, it can start growing uncontrollably. Such a cell is called a cancer cell. Cancer cells are out of control. They can also spread to other tissues. This is why cancer often starts in one part of the body and, if not treated, spreads to other parts. When a cancer cell spreads from one part of the body to another, this is called metastasis. This process disrupts the normal functioning of our body. At the end of this video, we will discuss the exact reasons for gene damage and how to prevent it. Now let's talk about cancer treatment. The most common treatment for cancer is chemotherapy. This is the process of using strong chemicals to kill cancer cells. However, these powerful chemicals do not only kill cancer cells, they also kill some healthy cells. Chemotherapy targets cells that are dividing quickly. This means that healthy cells that regenerate quickly are also attacked. This is why many people who go through chemotherapy lose their hair. Our hair follicles are fast-growing cells. The cells in our intestines also regrow rapidly. That is why people undergoing chemotherapy often face digestive problems. These can include vomiting and diarrhea. Moreover, chemotherapy can damage the bone marrow cells. Bone marrow is the soft tissue inside our bones. It helps produce blood cells. There are 2 types of bone marrow. Yellow bone marrow turns into fat or bone cells. Red bone marrow turns into red blood cells, white blood cells, and platelets. If chemotherapy damages blood cells, it can lead to anemia. This means there aren't enough red blood cells. The hemoglobin level can drop, which is very dangerous. Platelets help the blood clot. If there are not enough platelets, it can lead to excessive bleeding. White blood cells are important for our immunity. They help us fight infections. If chemotherapy lowers the number of white blood cells, the chances of getting sick increase a lot. This is why doctors recommend a balanced and nutritious diet during chemotherapy. It is also important to get enough sleep and manage stress. People should wash their hands, often wear masks, and practice good hygiene to avoid infections. Regular exercise is also important. Now let's say that chemotherapy kills the cancer cells. But what about the healthy blood cells that were destroyed? To restore these, we need a stem cell transplant. This is also known as a bone marrow transplant. It is often a treatment option for patients with blood cancer or blood disorders. In some cases, the patient gets their own healthy stem cells. This is called an autologous stem cell transplant. Blood is taken from the patient's arm and sent to a machine that separates the stem cells. The remaining blood is sent back to the patient's other arm. After chemotherapy kills the cancer cells, the stem cells can be returned to the body. In other cases, a donor is needed because the patient may not have enough healthy blood cells. This is known as an allogeneic stem cell transplant. When receiving someone else's stem cells, it is important to match the HLA typing. HLA stands for human leukocyte antigen. It is a part of the immune system. There is a 25% chance of matching HLA typing with a sibling. If no match is found, the patient may need to look for a match from a donor registry. This can be a lengthy and challenging process. Finding a good match can take a long time. Many people are aware of stem cell transplants for blood cancers, but there are also research studies on using stem cells for other types of cancer. Research on stem cells is still ongoing. New methods to use stem cells for different cancers are being studied. In some research, scientists are trying to use stem cells to target tumors. The goal is to use stem cells to deliver drugs directly to cancer cells. This can help reduce damage to healthy cells. Now let's discuss gene therapy. This is another exciting area of research. Gene therapy is when scientists fix or replace damaged genes in cells. This can stop cancer cells from growing. Scientists are using different techniques in gene therapy. For example, in some cases, scientists can introduce a normal gene into the cancer cell to replace the damaged one. This can help restore normal functioning. In other cases, scientists may use CRISPR technology. This is a powerful tool that can cut out the damaged part of the gene. Research on gene therapy is still developing. However, it shows great potential for treating cancer in the future. Scientists are also looking into vaccines for cancer. Just like vaccines for other diseases, cancer vaccines can train our immune system to recognize and attack cancer cells. For example, there are vaccines that help fight cervical cancer. These vaccines are designed to prevent infections from human papillomavirus. This virus is linked to cervical cancer. Another example is the Sipuleucel T vaccine, which is used for prostate cancer. This vaccine helps stimulate the immune system to fight the cancer cells. In conclusion, cancer is a complex disease. Understanding it requires knowledge about cells and genes. Many factors contribute to cancer, including smoking and alcohol. Cancer treatment has advanced with chemotherapy and stem cell transplants. New research in gene therapy and cancer vaccines shows promise for the future. By taking care of our health, avoiding known risks, and supporting ongoing research, we can all work toward reducing the chances of getting cancer. Thank you very much.